So one of the things that physicians look at is what's your absorbed dose of radiation. You'll see a lot of different units. You'll see it in millisieverts. You'll see it in Gray's units. You'll see also, I think, what it's Roentgens, right? And they all have different different quantities associated with them. And I did this because as I was reading the information about Japan, I kept reading about millisieverts, but all my medical information was coming in as Gray units. How many Gray units do you absorb? So I wanted you to see that one Gray unit was 1,000 millisieverts. So that was information for me. If you get exposed to 1 Gray unit's worth of radiation, that will cause you to have medical symptoms. Okay, 1 Gray unit. So it won't necessarily kill you, but you will get symptoms. If you get 6 Gray units of radiation, you absorb that dose, dead man walking. You are not going to survive that, and within a few days to 2 weeks, you will be gone. Okay? There was, a few years ago, a former KGB agent whose name I cannot remember, but probably couldn't pronounce it if I did remember it, who was actually poisoned with polonium and died from severe radiation. It was in the news, but people are more interested in what's going on in Britney Spears' life these days than they are in, things like this. But he was actually poisoned and killed as a former KGB agent by getting radiated by a dose of polonium. When you get exposed to radiation, the parts of you that you have a problem with medically are the parts of you that are reproducing the most rapidly. So, like Brendan said, it messes up your DNA. So what are the cells that are turning over? Am I not showing up?
No, I just have a lot of those symptoms.
Oh,
I think it's
stop.
age.
That should be my roommate for all those years. So what you're looking at, if you look at all the different tissue types in your body, you have nervous tissue, which is your brain and your spinal cord and your nerves. You have muscle tissue, and nerve tissue is relatively stable. You're not like, unfortunately, for some of us, you don't grow a whole lot of brain once you have your full adult brain. Muscle, you can make it bigger, make it stronger, but you're not growing new muscle. But this tissue type that changes and grows continuously is skin tissue, like epithelium, the stuff that lines your GI tract. The other thing that turns over rapidly is the cells in your bone marrow. You're making new red cells every couple of months. So when you get exposed to radiation in the lower doses, the very first things that are going to go, so to speak, are those epithelial tissues. When we're looking at people who are exposed, we're looking at, okay, here's the time of your exposure. One of the ways we tell how bad it is for you is, what's the time frame? You got exposed at this time. When are you developing symptoms? If you develop symptoms immediately, that makes us very worried that you got so much of an absorbed dose of radiation that we might not be able to decontaminate you and potentially save you, because it's palliative care after that. So the longer the time frame between your exposure and the time you develop symptoms, the longer that time period is, the better it is for you. Most of the time when people first show symptoms, it's nausea, it's vomiting, it's diarrhea, you have a headache, you don't feel well. And a lot of times after that initial period, you seem to rally a little bit and seem better. Unfortunately, shortly after that seemingly normal period, the symptoms often get worse, and the worse they are is based on how much of the dose that you got. So you can follow with the late symptoms of you're dizzy, you're disoriented, you don't have an understanding of where you are. The vomiting and diarrhea can then become bloody. You can have hair loss. Your skin changes quality. You can't heal wounds. Your blood pressure can't be maintained. And then, if the dose is big enough, these people die. When doctors are assessing you for what happens to you, the first thing they want to know is how much information can we get? So they're taking a history. Where were you when it happened? How close were you to the center of this event? How long were you there? Were you able to get away right away? And then, when did you first start noticing abnormal symptoms compared to the time that this event occurred, this exposure occurred? A couple of things that they're going to do is they're going to follow a CBC see their blood count, because like I said, your bone marrow turns over so quickly that you can watch it. They'll get a CBC on you. A CBC is a complete blood count with a differential. So the complete blood count is telling you absolute quantities of different blood cells, and the differential is saying, okay, you have this many white cells. How many of each different type of white cell do you have? They'll try to get one as close to the exposure as possible, because that'll be the one that's closest to normal, and then they'll follow it serially every few hours just to see how rapidly, if and how rapidly those levels are dropping, because usually it means that they're dropping. Another thing they can do is potentially check your dose of radiation with a dosimeter, but that dosimeter only works if it was at the original event. Another thing they could do is check you with a survey device like the Geiger counter to see, are you still sparking? Like, are you still sending off the, and actually shouldn't, it's really terrible, but that's one of the ways that they look at you, and they look and see from that original site what type of radiation that you were exposed to, because they can do different things for you based on what you were exposed to. Like, there would be a different protocol for you if you were exposed to radioactive iodine. That actually could give you the pills and potentially prevent that iodine from being taken up by your thyroid and potentially giving you thyroid cancer and causing you problems. So one of the things that you would do is, once we get you out of the site, we have to decontaminate you. So you got to take off all your clothes, you got to get rid of anything that's on your skin. Another thing is they're following those complete blood counts to see if you're having a drop. There are medications that we use for people to stimulate their bone marrow to actually make more and new normal cells that are generally used for people who have cancer and different types of medical issues where their bone marrow wouldn't be produced. And I threw a couple names in there, fulgrastin and purfulgrastin. And another thing that they can do is actually give you transfusions of blood products, including platelets. The Ki is potassium iodide, so if you're exposed to iodine, radioactive iodine, then that would be given to you. You use iodine. If you ever look at your salt, the big containers of salt, the blue, it's got the blue label and the little kids on it or whatever. Salt is iodized. It's a public health measure, just like the same concept as putting fluoride in water to prevent cavities. Iodizing salt so that people have enough iodine to incorporate into the production of thyroid hormones so you don't get a goiter, etc. So I could give you those pills so that you would have this big dose of normal iodine that would compete for the radioactive iodine so that your thyroid would get the normal stuff in a higher percentage. There's another product called Prussian Blue that'll bind to very specific types of radiation, the cesium and the thallium, okay? And that's excreted by your GI tract. That's the nicest way I could possibly put it for. It's all for people we're eating. And also DTPA is another chelator or binding agent that would help a person who got exposed to plutonium or curium. And just when would you get exposed? Thank heavens, it's only in catastrophic circumstances. A nuclear reactor disaster like in Fukushima right now, in near Sendai. I've read recently, and you guys, all this technical stuff you know better, but they're saying now, I'm reading things that say that the disaster there is now to the level of Chernobyl. Like they believe that it is now equivalent to Chernobyl. If a nuclear weapon is detonated, so think of poor Japan, good heavens, in the past, 60, 70 years, they've had 2 nuclear weapons dropped on them. They've had this, there was the Minamata Bay disaster with the mercury. Yikes, that's like the island of catastrophe. And then the thing that we are worried about in this country is this detonation of a dirty bomb. So that you use a conventional explosive device, but you have radioactive material in it that would disperse around to a certain radius around that site that would expose everyone to radiation. And I think